Good morning. Good morning, ladies.
Good morning.
Hi there.
It's always great to be an early morning panel during the week of time change. I don't know if any of you are feeling it, but it's taking a minute to adjust. I'm excited to have this conversation this morning. As was just mentioned, and if you haven't been paying attention for the last year, I mean, to say that healthcare is changing or has changed is a little bit of an understatement. So these ladies have certainly had a busy few years, and that doesn't show any signs of slowing down. So we're going to jump into some conversation and talk about how you're really leading through that. Given everything that we know that's changed in healthcare policy federally at the state level over the last year or so, and that continues to change, Shannon, maybe I'll start with you. What are you seeing as like the biggest shifts in healthcare really in Georgia?
So good morning, everyone. Excited to be here with you. So certainly the biggest shifts.
Well, and I should say, tell everybody what you do, what
Sure.
your role is at
Yeah,
Grady
I'll
a little
start
bit.
there. Yep, great. So I'm the Chief Administrative Officer for Grady. I've been with Grady for 14 years. My role is a combination of strategy and operations. I have all of our strategy, population health, community benefit planning, and then a good bit of our operations around our response to 911 in the city of Atlanta and South Fulton, a number of our service lines, our facilities management, clinical engineering, EVS, IT, and pharmacy. So kind of a broad swath across the health system that allows me to kind of tie together our strategy and how we're carrying that out every day. And so for changes that we see, particularly in Georgia, really, and I think we probably will all say it's going to be on the revenue side and how we get revenue. So we've seen a number, just in the last couple of years, I'd say my first 5 to 7 years at Grady, we were kind of constant with who our top payers were, who are the patients, what coverage they had. We knew kind of what that was going to look like year to year. And about 4 years ago, that started changing pretty dramatically. So we went from, maybe coverage, what we saw a payer go up really high, and then another one we had fewer folks. This is just people. So changing in folks' coverage kind of causes you to kind of follow the rules a little differently with every payer, and so that's one aspect of it. And then, as we've talked about, you've probably heard a lot in the last short time, 6-7 months, of the exchanges. And so we saw a huge increase in the exchanges over the last couple of years. So folks who were on the marketplace exchange had coverage through that. Those subsidies have gone down for a number of folks, and so we're seeing that drop quite a bit. And so shifting from where we had an increase in commercial coverage back over to uncovered patients, and working kind of day to day right now through people who might be signed up for a procedure whose coverage isn't going to come through at the end. So certainly on that front, on the funding piece, kind of everywhere you turn, we rely a lot on 340B coverage. There's a couple of hits to that as well. So the revenue side is making kind of operations a little interesting and challenging. And I'll say kind of it's more everywhere on the national front, but certainly here in Georgia focused on AI and technology and how that's going to continue to drive for good. It'll help us to improve operations as we use AI and certain technologies. For bad, it might help payers not pay us as much, or drag out some of those payments. So those are some of the things we're seeing.
And I might come back to a little bit and set the stage for our non-healthcare lady friends in the audience in just a moment. Lori, tell us about kind of what your role is at Northside and kind of what you're seeing from a little bit of a different lens.
Sure, thank you so much. And thanks to the Chamber for having me here and being a part of all of these esteemed women and my panelists. So I echo definitely everything that you said. And let me tell you a little bit about myself. I guess I should step back. So I'm the Director for Oncology Clinical Operations for the Northside Hospital System for the Cancer Institute. So I cover all of our hospitals across our 5 campuses. I also have all the inpatient medical oncology units, our bone marrow transplant unit in the Atlanta campus, as well as all of our oncology APPs. I cover them, look at all the operations, daily activities. We also have a component of physicians as well, our oncology hospitalists. So I cover that as well. So very, very clinically based. And I've been at Northside for 26 years. I've been an oncology nurse for 40 years. So it's definitely a great passion of mine and feel very blessed to be in the position that I'm in. So definitely echo what you have said. but also looking at the Georgia market, we have seen, of course, great growth in communities, and one of our biggest strategies for the Cancer Institute is making sure that Georgians can receive their care within the community that they live in. So really looking at how can we push out the precision medicine, which is so important for our oncology patients, clinical research, and putting those strategies in place along with looking at all the funding component and how that is going to meet their needs. So I would say that's probably one of the largest things that we're seeing in the cancer side of care, is just making sure patients can stay in their communities, get the research that they need, and benefit from that local component.
Thank you. Dr. Henson, Lily, welcome. Tell everybody a little bit about your role, your hospital, where you are situated in the state, and then kind of from your perspective, what's really kind of top of mind in terms of change in healthcare for you right now?
Sure. So first of all, thank you for having me. I'm really honored to be asked to be part of this panel. So I'm a neurologist, practiced for 30 years in Seattle before coming to Georgia to work for Piedmont Healthcare as the chief of neurology back in 2015 when Piedmont was only 5 hospitals, and now we're 27. And have been blessed to serve as the CEO for Piedmont Augusta, the hub. So our hospitals in each of the different regions are broken into hubs. So I'm responsible for the 3 hospitals in Augusta. You know, healthcare is a really difficult industry to be in. From the provider side of things, whether you're a hospital or a physician or any type of healthcare provider, we all know that healthcare reimbursements have been dropping. So the financial health of organizations have definitely been at risk. And certainly there are a lot of healthcare systems out there that are struggling to just survive. And particularly with some of the changes that have been happening over the past year, particularly rural hospitals are really at risk. Add on top of that what's happened in the past year with respect to the uncertainty around exchange subsidies and the fact that we are no longer providing, the government is no longer providing subsidies to patients who've been on exchange plans. There is going to be a huge impact on our patients, right? First of all, folks will think they have insurance coverage and then show up with their insurance cards and then later on realize that they can't afford the actual premium for this insurance that they've previously had subsidized, yet they still need care. And so the fear is for all of us who provide health care is that our patients need care regardless of whether or not they can pay, and our obligation is to take care of them regardless of their obligation to pay. One of the bigger fears is that our patients will show up sicker because they've delayed care because they don't have insurance, and we're going to have to figure out how to do that at the same time that, again, healthcare systems are already struggling from a financial standpoint. The other piece of it is the healthcare workforce. So if you look at the data, and actually the Georgia Chamber just sent out something yesterday, I believe, that talked about the labor workforce. And if you look at the individual sectors in which jobs are either growing or going away, healthcare is actually the biggest growing sector in terms of demand for workers. And a lot of traditional sectors are losing jobs partially because of AI, right? And so it's a very big problem for all of us in the healthcare industry in order to have well-qualified, compassionate healthcare workers helping take care of our patients. It's a national problem. It's not limited just to Georgia, but certainly there are some nuances that make it very hard for us here in Georgia to be able to get the workforce that we need. Particularly if you work in a metropolitan area like Atlanta or Augusta, where there's a lot of healthcare systems competing for the same number of healthcare workers, that is a problem. It's less of a problem if you're, obviously the only organization in town because you're in a smaller community, but it's a big problem.
A couple of things y'all have mentioned we're going to dig into a little bit more, and just to kind of set the table a little bit for our audience, when hospitals talk about reimbursement and payers and providers, a good predictor of a hospital's kind of baseline profitability or even just viability and sustainability is really what we refer to as their payer mix. The proportion of their patients that have commercial insurance from an employer, like many of you have, employees that you provide health insurance coverage through, or through some other plan. If they went to the ACA exchanges and got a plan previously, probably, 750,000 Georgians probably got a tax subsidy to do that up until January. A number of payers or patients covered by either Medicaid or Medicare, which traditionally don't cover the full cost to provide that care. And so the hospitals, our panel up here is constantly trying to balance this need for, their missions to provide care and generally, kind of across the board to promote and increase access to high quality care for Georgians everywhere, to meet community needs with compassion. How are you approaching that with the balance of really like operational sustainability in sort of an ever increasingly challenging time from this reimbursement mix? I mean, certainly the federal landscape is changing on what that looks like as well. I mean, Georgia has been spared from a number of immediate cuts, but certainly in the out years, certainly some of these fund sources are slated to have some rollbacks and reductions even further. Like, maybe Dr. Hinton, we'll start with you this time. Like, how are you approaching that, right? To continue to provide the care for your community compassionately, knowing that you still have to, like, at the end of the day, balance the books.
So in my organization, we put the patient in the center, right? And that is clearly what we focus on. So regardless of their ability to pay, regardless of what their individual circumstances are, our job is to take care of those patients. I'm lucky to work for an organization where we really focus on fiscal stewardship. That's one of the anchors, in addition to quality, safety, and service, with taking patient care in the middle of everything we do. And so we are really fortunate to be good stewards of our resources. As an example of that, we really try to reduce waste. So how do we operate as an operating company so that we can use the efficiency of being a large healthcare system to reduce some of the costs associated with individual hospitals. Whether you like, mergers or acquisitions or not, at the end of the day, that consolidation is something that helps us be able to survive financially. We also are very thoughtful about how we spend our dollars. So, if we have someone who leaves us for, a different role somewhere else, we have a conversation about whether or not we actually need to replace that position, right? So most of the time we do, but sometimes, work responsibilities change, and so that position is really actually can be absorbed by somebody else or a number of other individuals. So we have those conversations. And then because of our the quality of care that we provide, we're actually able to get reimbursed by the commercial payers at a reasonable price, so that allows us to be able to, again, take care of all of our patients.
Shannon, how's Grady, as a safety net provider, has a particularly challenging sometimes payer mix. How are you guys really approaching your true mission to provide access with kind of increasing financial pressures?
I'll start with, we ask every patient that comes through our door, whether they're outpatient in the emergency room or inpatient, their social needs. So we start with asking about the social determinants of health. And so that's how we ground ourselves in what the patients need from us. And then when they tell us what they need, we say, do you want help with that? And we help them to do that. So it's really, that part is about creating kind of the right network of both healthcare providers and community providers. We can't do it all ourselves. And so being able to know that, to know what our patients need, and to be able to create those, that hub of connectivity to address food, housing, transportation. I'm not going to say that's easy, but being able to at least have a system to do that and know it is part of where we really drive that compassion for our patients. But certainly the financials are an important part of that. And so you've seen a lot of, I think those in Atlanta have seen a lot of kind of where we try to work to differentiate ourselves. It's really important for Grady to have a balance of a broad range of services where we differentiate, like our trauma, our stroke, our burn centers, some of the ways in which we deliver care and our other service lines, so that we're able to both balance from a payer mix perspective as well as a procedure mix perspective. And so being able to know our patients and have that drive those kind of revenue sources to help to overcome the challenging payer mix that sometimes we have. We're also, I'll say, we're continuing to look, right now we're doing it more by disease state, but how do we manage the unfunded as if they have insurance? And so looking at, kind of as you were describing, kind of that stewardship of lower cost but higher quality is really ultimately fits in any health system. But if we look at, a lot of times we don't look at the unfunded that way, we want to, but they don't have that easier access. But if we look at them as if they have coverage and treat them that way, then you can have a better outcome that often is less expensive.
Lori, you're in a little bit more specialized just oncology. Are you feeling the same pressures there to continue like really highly specialized services in a sort of constrained market?
Yeah, and I would say we do the same thing from we look at an assessment of our patients on the outpatient side and our medical oncology practices on the inpatient side. What do they need and how can we meet that service? And I would say, operational efficiency and compassion go hand in hand. I don't think you can have one without the other. And many times people look at healthcare providers and systems and say, well, how can you cut that or cut this or not do that? But we're constantly looking to say, how can we be more efficient? How can we take somebody, like from my perspective, a patient that is at home one day and in the emergency room the next with 100,000 white count and is told they're going to be heading to the bone marrow transplant unit, and they're going to be there for 6 to 8 weeks. They're the breadwinner. They are the mother taking care of their children. So we have to meet the patient where they are and provide that. And the only way we can do that is by being operationally efficient with cutting wait times, looking at refilling an FTE if we need to, so that we can then provide that assistance, because we get patients all the time that do not have health insurance. They do not have the financial stability to weather, a year worth of cancer treatment. So our system really does look at how can we financially support that person. We do a lot of financial assistance. We have foundations to help provide that. We go through drug companies to get drug assistance for the long-term chemotherapy that patients have to endure. Yeah, compassion is about decreasing somebody's anxiety, right? And the way we can do that is through the operational efficiency that we have to do through healthcare.
And I want to jump on the comment about the fact that we have to take care of the whole patient, right? Not just the medical needs of the patient, because otherwise you can't. And so, and we can't be everything to everyone. And so one of the things that we do is we, at Piedmont Augusta, we push out into the community $2 million every year to nonprofit organizations that help serve the community needs of our patients. So whether it's having access for our homeless patients to, or food insecurities, or transport, right, for our cancer patients for their daily radiation therapies. So we can't provide everything, but we can support those organizations that are out in the community who do take great care of our patients with us. So partnership is really important.
Dr. Hinton, you touched on the workforce and the fact that, certainly one of our priorities at the association is developing Georgia's healthcare workforce. One of probably the most critical challenges facing healthcare across the country, as we see more and more adults aging, needing higher and higher levels of care, fewer people to provide that care, fewer numbers of enrollment across our post-secondary institutions, and not just physicians, right? We need every manner of healthcare professional, whether it's, physicians, nurses, all of the allied health sciences. But yet we expect so much out of our workforce as well. I don't know how many of you have seen posts on social media when there's a storm coming, how many healthcare professionals are planning to camp at their hospitals, essentially. They're packing bags and showing up and providing around-the-clock care. How are you, as leaders, really leading your teams through this, like, burnout and real shortage? How are you supporting them and leading them through this really kind of acute workforce? Shannon, do you want to start with that?
This started for us, obviously, during the pandemic. Well, maybe not obviously, but that was when it really kind of came to a head. And I'd say specifically with our EMS workers, our response to 911 and the emergency department and nursing probably were the three that we heard a lot about. And what I heard specifically from folks on the front line was the EAP service is good, the Employee Assistance Program, but that's not cutting it. And so we put a couple of programs in place over that time. One, we developed a resiliency clinic, I guess is what we called it, center clinic, out of our behavioral health program. And we did that because what we heard was we need people who know what we're going through. We need people who know what a day-to-day is, not, someone that's kind of sitting outside of healthcare, maybe looking in or outside of the hospital setting. And so we worked to get that program in place. It's a warm hotline. So we've got 2 or 3 clinical therapists who respond to that. You can set up sessions up to work over 6 months with folks, with the team there. They also respond to those really maybe terrible incidents when we lose a child, or have an employee involved in something that's tragic that our folks see kind of firsthand. They respond to those situations as well. So that has been really, really impactful for our folks. We've got signs everywhere, call the Employee Resiliency Clinic. They're on it whenever something happens. We've had great feedback for that. We also put in place a We Care program. It kind of layers onto that. And that's a peer specialist program tied with our psychologists. And they, again, will be kind of that teammate who kind of checks in with folks to make sure, you had a rough day. It looks like maybe you're struggling a little bit here, or just do you need somebody to talk to? Also responding to more tragic events as well. So trying to layer in programs that folks can get right there on site. They don't have to leave to provide that resiliency. And then the other part of it, I think on maybe the positive side, or not, that's the responsive side. On the proactive side would be giving our teammates innovations to lean into. EMS is a great example of this, where we introduced the whole blood program. And we have probably about a half a dozen or a dozen paramedics who've been with us 20 plus years. And through the pandemic, over time, shortages, all of that, you saw them kind of wearing down. I don't know how much longer. And we introduced the whole blood program, put them in charge of it, and they were, took 12 years off of their experience, 20 years off their experience in terms of that time they were rejuvenated, connected, introducing mobile stroke, introducing those innovations that folks can maybe change what they're doing and see something new in their work, I think has been really, really important for our team too.
Lori, what about at Northside?
So we are doing some of the very similar things. I will say, I know that the pandemic affected every part of our lives, and every one of you probably can speak to something from that perspective. In healthcare and nursing in particular, for oncology, we really depend on treating the entire component of a patient and a caregiver. It's not just the patient going through the cancer diagnosis, it's the entire family, it's the extended family. And so when the pandemic hit, and we started not allowing visitors in our healthcare settings, our caregivers weren't there. I think about the situation with our bone marrow transplant unit, where there are patients that are on that unit. It's a very isolated unit, and the caregivers are so extremely important. Our nurses and healthcare providers had to become healthcare providers and caregivers. And our nurses were so phenomenal in that. For our patients that are there for long periods of time, we try to normalize things for them so they don't all wear hospital gowns. They bring their own clothing, but that has to be laundered. And our caregivers take their clothing home and launder the clothing. And so the nurses were like, what are we going to do? We don't have washing machines on the unit. What are we going to do with this? But they got together, and this is the resilience of, I think, our healthcare providers, and they set up an exchange system with the caregivers outside the hospital to exchange the clothing for the patients. So it was, it's very impactful. I think we all are still having PTSD related to that. There's still moments when things occur that you can see it in people's eyes, which is why these programs for wellness for our employees are so important. And I do think that, burnout is not an individual responsibility, really is an organizational responsibility to identify that and provide particular supports through the services that we have. From a shortage perspective, which can also lead to burnout, we have done many things at Northside after the pandemic because there was such a shortage. People my age retired and they decided to get out of healthcare. They retired early. People weren't going in. We had nursing schools that couldn't provide inpatient experiences. They were doing everything virtually. So then you're getting a workforce that's never laid their hands on a patient. So we had to think through that and how are we going to support these new grad nurses that are coming into the system. So we've developed many pipelines from looking at our new grads that are, or externs that are in a junior year of nursing school and providing an externship and a pathway to residency. We've really built back many of our service lines through residency. So really bolstering that, looking at how we can use international nurses. We have a huge international pipeline as well. So that also helps with burnout because you're supporting your staff, you're getting staffing levels back up to where they need to be. So those are just a couple things that we've done at Northside.
Lily, how are you really supporting your teams, leading? You're a woman in charge of an entire CEO. You get your own life demands and pressures. How are you really leading through that for yourself and for your team?
Well, that's an interesting question. I treat my staff, all 4,000 of them, as I would treat my own family members. And I think that's really important. One of the things I think, we tend to do is put our workforce in a homogeneous group, but they're not, right? We have folks who've been around for a long time, who are loyal to organizations and want to be with a particular organization. Then we have the younger generation who literally jump jobs every 6 months or 2 years because that's the norm for that generation. And so meeting them where their needs are is really important. One of the things I've done is I've stolen from nursing. Nursing has something called shared governance, where they bring together both the leaders as well as the frontline nurses to talk about problems, and the frontline staff are the ones who come up with the solutions because they're the experts. And so I stole that idea from nursing and extended it to all of our employees. So we have a hub shared governance where people from all different departments, whether they're clinical or non-clinical, whether they're system employees or my employees, or whether they're virtual or in person, getting together and talking through solutions to problems that affect all of us. An example of that is childcare. So childcare is a big problem, and if you think about the fact that the majority of healthcare workers are women, and we still traditionally have childcare responsibilities, trying to find a solution that makes sense was something that was really important. So one of the things that we did at Augusta was to meet with the YMCA of the CSRA, the region. So we have about 25 counties that we serve, and it just so happened that the YMCA had facilities in all of those counties. And so since our employees come from those areas, they could tap into the Ys in their counties for before school, after school programs, as an example, or camps for when schools are on break. And we help pay for some of that. And so making it easier for our staff for the problems that they deal with on a day in and day out basis is something that's really important. The other thing that I think is really important from a leadership standpoint is being there, right? And so, one of the things I do is I go wander around the hospital. I usually get lost because most of you, if you've ever been in a hospital, they're usually a patchwork of buildings that have been put together. So my staff actually joke about putting an RFID on me or an AirTag on me so they can figure out where I am because I'm always lost. But it allows me to wander into areas that a lot of times leaders don't wander into, and being able to have conversations with the frontline staff and hearing, what's working well, what isn't working well, what is in my job description to fix for them so that we can make their jobs easier is something that's really important.
Kaylee, I was just going to say that is something I totally agree with and am glad to hear that that's happening there too. For Northside, that is an expectation of the executive team, is that they are doing consistent rounding on units, being, having honest dialogue, making that environment open so that staff can voice, to a CEO or a COO or whoever that might be, so that they know they're being heard. And the expectation is that they're not just heard, but if there's a problem that is brought forward, a concern, that they're following back with an action item to that staff member so that it's a full circle and that there's change.
So just to jump on that, so the first time I did that when I first got to Augusta 3 years ago, I was wandering around the hospital on a Saturday, and because, hospitals are 24/7, it's not just, banker's hours, Monday through Friday. And
No offense to the bankers in the room, we appreciate you.
Right? But my chief nursing officer got all these panic text messages because her managers and her directors were saying, what the heck is the CEO doing in the hospital? I mean, is she here to fire us? And I'm like, no, I'm just here to hear. But if you don't set that as an expectation, it doesn't happen. The other part about burnout, right, is that is how do we as leaders reduce the work that our staff have. So two of the things that we've done is take advantage of technology. So we spend a lot of time on our computers for our clinicians, and they log into the computer to be able to document what's happening with their patients. Well, it has to be very secure, right? Because patient privacy is really, really critical. And so every time you step away from your computer, it turns off, and you have to log back in every time you turn around to do that. And so we have, badge swipes so that our badges automatically log you in so that you reduce the number of times you click on the computer. That's an example. The other thing that we've started doing for our physicians is using this program that allows them to dictate the note while they're talking to the patient. And it's a, I'm dating myself. I can't actually explain what happens. But basically, the conversation that happens between the patient and the physician is documented. And then all the extraneous stuff like, oh, I had, a baseball game to go to last night, stuff that isn't really relevant to the medical records gets taken out. And you really have a comprehensive note, which is important, but takes away the hours, and literally hours, that our physicians spend in documenting after they've seen the patient, or take away the physician typing on their computer as opposed to having face-to-face contact, eye contact with their patient. So that's made a huge difference.
I just have to say this, sidebar. I mean, I don't know if anyone in here has watched the show The Pit. Have you? I'm sure y'all have. Yeah. It's probably worth the watch. Like, it's a docudrama based in an ER, but they really actually hint at some of these very real policy challenges, whether or not it's reimbursement, insurance coverage, social determinants of health and needs, and workforce. And they're actually, in a recent episode I was watching, introducing these new AI tools that reduce, workload, and hopefully in an effort to prevent burnout. It's a fascinating watch. So. My 2 cents of a plug. Turning a little bit more, and Shannon, I'll come back to you, a little personal question about your leadership skills and style. What's probably been your leadership skill that's been most critical in navigating such a highly regulated and complex and policy landscape? Like, what's really been that skill that's helped you the most?
So I already kind of used the word, but resilience. I think that's one. But I also think, I'll say, a couple years ago, I got some feedback from a board member. It was really kind. He wrote me a note and sent it to my home. And it was after, again, Grady history, we had a big flood in 2019, and then went straight into the pandemic. And his note to me said, thank you for your composure throughout all of the kind of ups and downs and turmoil, that your kind of steady responsiveness and kind of and dependability. So that was some feedback I received from a board chair that I think that's what I would say would be kind of the characteristic that it kind of helped me to get through whatever's next.
Lori?
I would probably say just clarity and complexity. I think that's been my gift along my pathway as even being a bedside nurse, at just being able to do a quick assessment of something and say, okay, let's look at the top items here. Because a lot of times people can get bogged down in the weeds and they miss what's up here. And so I do think that's probably something that's really helped me along my pathway.
Lily?
Well, that's an interesting question. So two things. One is focusing on the patient, right? So when all hell breaks loose, whether it's a pandemic or a flood or a hurricane or whatever, if you focus on the patient, that gives you that clarity, because everything else falls away. It doesn't matter if my husband's at home waiting for me to cook dinner. If there's something that revolves around a patient need, that's the priority, number one. The other piece of it is I think of, I guess the term is resilience. So I think about the years I spent in college and med school and residency, where survived on very little sleep and just slugged through it. And the only thing, and in my mind, the idea is if you can survive that, you can survive anything. And that actually led me to running marathons back in the day. So, if you can slug through residency, you can do a marathon. And the same is true for work.
I'm going to stay with you in slightly different question. Being a woman in a leadership role, certainly in healthcare, I'm sure you've all experienced challenges. Tell me a little bit about one of those challenges that you've faced in your healthcare leadership capacity, specifically as a woman.
I can tell you a whole bunch. How much time do we have? I think really, I originally had a particular answer, and then I decided to kind of segue. I think imposter syndrome is a big problem for all of us women. And I'll give you an example. I interviewed for my current role, and I had this 40-page CV. It's for those of you in medicine, it's an academic CV, so it's really thick. Despite that, I would have been picked over for someone else who is a male. And it's really around the relationships that men are able to develop in the workplace that sometimes we as women don't do such a great job at, right? We're busy, taking care of kids, going home and cooking dinner and doing all the other things that we still do as traditional women for the most part, and don't go and hang out with the boss and, play golf and or shoot the breeze and do all that networking stuff that I think men are really, really good at, and I know I'm not very good at. I got the role, but it was purely because one of the people on the selection committee was a physician who read my CV and said, she's the real thing. She's a doctor who's had significant leadership experience. She meets all the needs that we have in this position. And if it weren't for someone who kind of stepped back and said, she's really, really qualified, I don't think I would have been in this role. And I blame myself partially, right, because with imposter syndrome, and the other piece of it is, if you haven't figured it out, I'm Asian, and so Asians don't self-promote, right? We just are not good at that. And so we have what we call, instead of a glass ceiling, we have a bamboo ceiling. That is really difficult for us to break through because we're not good at talking about the accomplishments that we've had. And this is not to sell myself, it's really about the barriers that I encounter or I've placed upon myself because of who I am culturally.
Lori, specific challenges for you that you've had to overcome as a woman?
Well, I think it's probably assertiveness in how you approach something from a nursing perspective. I think most nurses, hopefully, you've had this experience, are pretty compassionate, relatable individuals that you trust, you have confidence in. But when you have to put on an operations hat, you have to many times be very direct because you need to get something completed. And I have had people go, wait a minute, where did that come from? So, and probably if that came from a man, that may not have been looked at that way. So I would say it's really continuing to be confident in myself that I'm doing the right thing, that I can be direct. I think over 26 years, I've built great relationships at Northside, so that longevity, people know if I'm direct with them, it's because I need to be. But I'm never going to do, again, and maybe this is the female side of me, is that I'm never going to use that directness or assertiveness in a mean way. It's going to always have a flavor of, I need for you to do this, okay? So I think that's probably one of the things I've faced and been challenged with.
Direct with a side of charm, right?
Yes.
Yeah, they don't even know you.
Charm.
Shannon, what about you?
So maybe not a challenge as much as I'd say an opportunity, but it is, I often find myself, I'm the only woman in the room, which is every now and then you kind of take a step back and say, okay, it's 2026 and I'm the only woman in the room of 8 or 9 people. And so kind of using that perspective and trying to make sure that my perspective is heard. And so maybe that is the challenge, because sometimes it is hard to get a word in edgewise when you're the only woman in a room of 8 men who are typically probably a little older than me too. So there is that kind of, where do you insert that assertiveness? And I would also echo trying to keep traditional patterns from happening, I guess, and traditional kind of men's network, or however you want to look at it, trying to overcome that with the right words at the right time, with being assertive but not seeming. You always kind of have that challenge of, to your point, a man can maybe say it, or you say it, and you're called a word that you don't want to be called. So that would be a challenge too sometimes. So, so I think recognizing that perspective and using it for good.
How can you take those experiences and then within your healthcare systems support other women really walking into executive roles? I do tell a story about, it's been over a decade ago, more than that. I would not be sitting where I am today had it not been for a female leader in my life when a bunch of men had decided I was capped out. Like, she's literally said in a room, like, we think she's done, she's reached her capacity, and she said no. Like, we're going to take her and do something, and thank goodness. How do you feel about that responsibility in your organizations, and how can we really support women that want to step into roles?
Well, I think that there's two pathways here. I think we've probably all been mentors, which is very much needed, and but I also think, kind of to your point, it's also sponsorship. It's really giving the opportunity to someone who's not been in that either role or room or experience the opportunity to be. And, so you're mentoring them, but then sponsoring them, kind of like what your experience was, I think are very important components.
Lily?
She took the words right out of my mouth. I think I've been very blessed in my career to have had a number of sponsors who have, both men and women, who have pushed me forward and given me good advice and helped me see in me what I didn't see myself. And that's really critical. And then, we're very instrumental in terms of making sure that I didn't go make career-limiting moves along the way.
Yeah.
So.
Yeah, I agree.
Shannon?
Sponsorship, mentorship.
Sponsorship,
yeah.
mentorship.
And seeing folks, in healthcare, you can get kind of, you're in a part of an org structure, right? I recently had a woman that I hired who, for years, I knew what her potential was. And we worked together on both her operations, but also kind of expanding her strategy and her viewpoint there. And I had to kind of let her go to another department, which was kind of a bummer, but then she was able to, elevate to another position. So being able to see that potential and helping people move beyond kind of where they are within the organization.
How do you each sustain yourselves personally? You all work in very high-pressured environments, lots of demands on your time and energy and expertise, but personally, what are you doing to kind of keep yourselves well-balanced and sustained? Who wants to go first?
Lily goes to the gym. Lily goes to the gym very early, we learned already.
So, we were talking right before we came up here about how we each get up at some ungodly hour to go work out. So I was thinking about this answer last night. My dad died of lung cancer, and my mom died of, after having had a stroke, and my mom died of Alzheimer's. So as a physician, I'm very paranoid about not following that track. I don't know what I'm going to die from, but I'll figure it out. And so I really focus on my health, and that includes working out, which is really important, not just for my physical health, but for my mental health. I actually get a little cuckoo if I don't go and burn off my energy. And so working out is really important. I also carve out time to go get a massage, to get facials. You really need to go do that, whatever floats your boat, to make yourself feel like you're special and that you're carving out time for yourself. But working out is really critical.
Lori?
Yeah, I would say that as well. I know there's been so many times that I've been at a bedside with a patient and a caregiver, and I've told the caregiver, you've got to take care of yourself so you can take care of your loved one. So I think we just have to put that back into our lives and not feel like we're, don't deserve it. We have to have it to sustain ourselves. So definitely working out is important, eating healthy, taking time with family, making sure we're taking trips, taking some vacation time and enjoying it, and turning off the phone and the computer when you go on that trip. So it's very important.
Shannon, what are you doing?
I will definitely echo the early morning workouts and the weekend workouts and those, the massages and the facials. That I also, I feel guilty, but I watch a lot of mindless TV. I won't say a lot, but I watch mindless TV. You mentioned The Pit. I'll always lean into a good healthcare drama somewhere along the way because, that's our lives. But our ethicist asked me that recently, like, what do you do? And I had to just finally confess, I watch mindless TV a couple hours.
Sometimes you have to.
You got to do it. So, but that is kind of and I don't respond to emails during that time, and I just turn off. Yep.
Well, I actually have to add one more thing. So I recently read a book, I can't remember the name of it, but it was written by Archbishop Desmond Tutu and the Dalai Lama. And one of the practices that I learned, I think it was from the Dalai Lama, was every night when I go to sleep, before I close my eyes, I think about the 3 things that I'm grateful for. And all of us, and it's very inexpensive, so you don't have to worry about the gym or a massage or a facial, but you can always count or identify 3 things that happened in the day that you can be grateful for, even when all hell is breaking loose. And I think that is something that's really important and certainly helps me sleep through the night, which is also important for your health.
Well, that's a great note probably for us to wrap up on. I just want to thank the 3 of you. Obviously your jobs are really complicated, focused in both systems and strategy, but also I think important that you're focusing on people and purpose and leading with such courage to do these incredibly challenging jobs. So please join me in thanking our panelists and these remarkable women who are leading in healthcare.